I'm getting to experience another important first here as a host on Superior Morning this morning. I'm going to call this my commencement interview with Dr. Janet DeMille. She's our medical officer of health for Thunder Bay District, and she's joining me now with the latest on COVID-19 in the region. Good morning, doctor.
Good morning. I have to say, I was looking forward to talking to you, Sean.
Well, I'm glad. I feel the exact same way. It's always good to meet the people who are contributing and making a change in our nice little area in northwestern Ontario, and more specifically Thunder Bay.
Well, thank you.
So we saw 14 new cases in the district on Monday. We've had more cases in the first 10 days of November than we did in all of October. Is this trend making you nervous?
I'm not sure that I'm nervous so much. I am concerned. I would prefer, we did very well over the summer and obviously for September and October as well. And so it is uncomfortable when we start to see our cases maybe go up. And, it's not only here, but we see some other places, including in other places in Northern Ontario where it's going up. And this is what happened to us last year as well. We sort of did well up until the end of October and then started to see an increase in cases. However, at the same time, I think our case numbers are fairly low. Despite that, they were higher last year. And we do have a very good vaccination rate overall across the health unit area, and that's going to provide us some protection. However, I think what I'm probably concerned about is those people those areas where maybe the vaccination rate is a little bit lower and where we could potentially see spread. And, we have some cases here in Thunder Bay, but, we have some cases are outside of Thunder Bay in the district area and impacting First Nations communities. And we know that First Nation communities have been overall disproportionately impacted by the pandemic, not only here, but in other parts of Canada. So I feel a little bit more, concern about that and maybe worry around that too.
Now, what can you tell us about these cases? Were the people vaccinated, unvaccinated? Do we know how they got the virus? Was contact tracing done?
Yeah, we do. We follow up with everybody, and we have partners who follow up when it's First Nation communities, and we do paint a picture. And I think in general we can follow where people got it from, and that is good. We don't have, for example, here in Thunder Bay, evidence of broader community spread where we don't necessarily know where people are getting it from. And I think, what we've seen in terms of, the last several months, some of our cases have arrived here through travel, so people coming from other areas or had traveled through other areas in Canada, notably where there's a higher rate, and they probably brought that with them. And in terms of the vaccination status, we did release some information last week when we looked at our cases since the beginning of June, that about 15% of them, so I think there was 180 cases, and 15% were fully vaccinated, and about a little over 75% were unvaccinated.
Now, the medical health officer in Sudbury has added new restrictions in the district beyond those imposed by the province. At what point might you consider invoking, I believe it's Section 22?
So there's a Section 22 under the Health Protection and Promotion Act, or there's issuing sort of a letter of instructions under the Reopening of Ontario Act, which is what my colleague in Sudbury did. And it was really to restore some of the capacity limits and increase vaccine mandates because they have I think a fairly substantial increase in cases in the Sudbury area. So I think that's what we might see going forward is sort of those local decisions to implement stronger public health measures in order to control an increase in cases. I did something similar when the schools were closed in Thunder Bay in the beginning of March last year because of earlier this year because of a surge of cases. So we're not at the stage where I would be looking at doing that now, but certainly if our cases were to increase, and especially if we saw sort of more uncontrolled spread, then measures like that might be needed to bring the numbers back down again.
Now, the province has just started rolling out booster shots to the population. Can you describe to me what some of those rules and regulations are? Example being 6 months after your last shot. Is it only to specific vaccines? What kind of information do you have on that?
Yeah, so last week or recently the province had announced about certain groups qualifying for a booster dose, and we've started implementing that with this week. And really it is looking at individuals who received primarily their vaccine over 6 months ago, like their second dose. So we know the vaccines, primarily when it was primarily Moderna and Pfizer, the mRNA vaccines that were used here. And 2 doses work really well. Like people should feel comfortable that they do work very well, especially to prevent severe outcomes, like hospitalization. But there is some evidence or indication of waning immunity. So after about 6 months, you can start to see a bit of waning in immunity. So the booster doses, which is actually a concept used with other vaccines as well, like the regular ones, a booster dose sort of boosts up the immunity that people would have received with their first 2 doses. And so the current, it's done, it's 6 months. It's actually 24 weeks, so a month being sort of 28 days. So around 5.5 calendar months, but people are eligible, and the current eligible group is seniors 70 years of age and older, Indigenous people, and healthcare workers. And a lot of these people would have received their first and second dose, some in the first 3 months of this year, and a lot of the seniors would have been May and June.
Now, is it fair to say then, or is it fair to expect that booster shots are going to be are going to happen on a regular occurrence, very much like other vaccines? So let's say once a year, where we get a booster shot.
Yeah, I think it's in many ways a bit too early to know how this is going to pan out in the future. I think what we're seeing and what we've heard from the province and what other jurisdictions are doing is these booster shots. And we do, although there are specific groups right now, we do anticipate that this will be offered to the general public come January or the January and February. And then this is sort of a more vulnerable time as we fall and winter. We see more spread of respiratory viruses like COVID-19 in the fall and winter. And so the booster shots are coming at an appropriate time for that. I think going forward, it's going to really depend on how long sort of immunity lasts. It's going to depend on whether we see variants and more different variants, or whether the Delta variant, which is the current one that we're experiencing, whether that and whether that changes. And then there is a possibility, that there could be sort of, a yearly offering of a COVID-19 vaccine, and the likely timing of that could be in the fall, and there could be a combined vaccine, for example, before the flu and COVID. It's a bit, though, hard to predict exactly how this pandemic is sort of going to go in the coming years, though.
Now, we're coming up to about a year for the implementation of vaccines and people getting them, their first dose and second dose. Have we hit a wall when it comes to people still getting those vaccines, or where are we at in vaccine uptake?
Well, we certainly here we have a very a good vaccination rate. I think on the provincial statistics, we're second out of 34 health units. So really, people have come forward, and a lot of people are actually fully immunized with their 2 doses here in the Thunder Bay district in the health unit area. So that's really great, and I have to say, good job, everybody, because that really protects our community. But we do see still people coming forward, and that includes for first and second doses. It has dropped off, substantially from where we were in the summer, and it's been a gradual drop off. And we're still seeing people come forward, for the second doses because there's still people who had one dose but not the second one, and they're coming forward, and our numbers are still going up, especially in the younger groups. So the 12 to 17 and the 18 to 29-year-olds are still coming forward, and I think that's really good. So, we're going to be offering sort of more boosters, and of course the 5 to 11. We are expecting the approval of the vaccine for 5 to 11 sometime this month, and we'll be able to roll that out fairly quickly once we get the supply for that.
Now, have you witnessed much more opposition to vaccines and vaccine mandates since CBC Superior Morning has last spoke to you? There are people opposed, whether it's to the vaccines themselves, but some people have expressed opposition to the vaccine mandates and the requirement to show proof. And I don't think that we've seen sort of more people come forward with that. People do make comments, whether it's on social media. We've had people, directly contact us and that, and I do sort of understand. But we haven't really seen what's been experienced in some of the other areas where there has been stronger opposition. Well, thank you so much for taking the time and joining me this morning, Dr. DeMille. I do appreciate it, and it's an absolute pleasure to finally speak to you and meet you.
Yes. Well, thank you very much, Sean, and welcome, belated welcome to this area, and look forward to talking to you again.
Thank you so much. We do appreciate it.
Thank you.
That is Dr. Janet DeMille. She is the medical officer for health for the Thunder Bay District.